Going into the 2020 election, healthcare is going to be one of the most important issues that's going to come up and define each of the individual candidates and the two major political parties. We are at a moment where we've got candidates arguing for single-payer systems, we've got candidates arguing for public options, and we've got candidates arguing to dismantle the Affordable Care Act. The contrast between the Democratic Party and the Republican Party on healthcare is pretty stark. And so that's really going to be a debate that Americans are going to have about what the future of their healthcare system should look like. Over the last several decades, as prescription drugs have become more common, we certainly have seen the price go up, but we've also seen the price of prescription drug staples, things like insulin, have gone up substantially over the last couple decades. But more and more, families are really struggling and seniors are really struggling to determine, are they going to eat or are they going to buy a set of prescription drugs? And that's become a really important issue in this campaign. But ultimately, there is a recognition in the healthcare system that we're paying too much for prescription drugs relative to other countries. And there's a concern that the companies that manufacture those prescription drugs are making too much money relative to what patients can afford. First and foremost, we have an older population, and so access to issues of Medicare or Medicare Advantage, cost of prescription drugs for Medicare patients, these are all things that really impact older Pennsylvanians who get out and vote. And since we're a swing state, how those older Pennsylvanians vote around issues of prescription drug coverage, around Medicare, around healthcare is going to be a really important issue. And that may actually ultimately decide the presidential election. The future of the healthcare system really affects not just our access to care, but especially here in Pittsburgh, it affects a lot of people's jobs. Our largest employer in Pittsburgh is a not-for-profit health system. And one of the parts of that not-for-profit health system is in fact a health insurance arm. And so how that health insurance arm is able to compete in the market, what their market is going to look like, how they're able to compete on the exchange, that all impacts a lot of jobs in Pittsburgh and Western Pennsylvania.